Tonight, the National Security Minister weighs in on an incident where a student was found in possession of a gun on a school compound. The Medical and Dental Association says a firm no to the use of ivermectin to treat COVID-19. And the Chamber of Commerce joins the growing chorus for incentives to be given to citizens to encourage vaccination. The details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Thursday, the 20th of May, 2021. Welcome to the Hot 7 TV Nightly News. I'm Lovelace St. Amy Joseph. Thank you for joining us. National Security and Justice Minister Herman Gill-Francis is weighing in on the incident where a secondary school student, still a minor, was found in possession of a gun. When children get into conflict with the law, the matter is always a sensitive one. There is a growing body of research that points to the effectiveness of rehabilitation programs that involve families and communities as a safer, more appropriate, and effective approach than punitive measures. There are arguments that justice systems designed for adults are more likely to harm than improve a child's chances for reintegration into society. The minister shares those concerns and says the best course of action is one that gives support to ensure reform and reintegration of the child into society.
I'm not privy to what has happened, how old the child is, and so on. So the Ministry of Social Justice will get involved. Our probation officers will get involved. Again, sometimes it's not being very punitive that will solve anything. Like I said, all of us, even as senior people, we all make mistakes. And so is to see how we can go into this child's background and see what did the child need some help. And I would more look at it as being out there to be able to help this child and make he or she know that this is not the right way and find out exactly what has happened. We don't know whether the child found the firearm or what under what circumstances that firearm came into the possession of the child. So before we crucify the child, I think we should now be able to be there for him or her and to see how that child can continue a good life in St. Lucia.
Organizations like the United Nations Children's Fund, UNICEF, strongly advocate diversion, which is directing children away from judicial proceedings and towards community solutions. It also advocates restorative justice, which promotes reconciliation, restitution, and responsibility through the involvement of the child, family members, victims, and communities, and alternatives to custodial sentencing like counseling, probation, and community service. The OACS Commission is collaborating with its member states along with international agencies such as USAID and the United Nations Children's Fund, UNICEF, to review, update, amend, and establish laws on multiple matters of social development in the Eastern Caribbean, including juvenile justice. In other news, the St. Lucia Medical and Dental Association is siding with the Ministry of Health and major public health agencies on not recommending ivermectin to treat or prevent COVID-19. The Caribbean Public Health Agency, CARPHA, is urging ministries of health and clinicians to only use the drug under conditions of well-regulated clinical trials for COVID-19. SLMDA President Dr. Merle Clark says the association does not and has never recommended the drug.
Ivermectin tablets are approved by the FDA to treat conditions caused by parasitic worms. Some forms of ivermectin are used in animals to prevent heartworm disease and certain internal and external parasites. Since the onset of COVID-19, some countries have begun using ivermectin to treat COVID-19, saying that their own studies have proved effective. The Caribbean Public Health Agency, as well as PAHO and the WHO, have advised against its use. The St. Lucia Medical and Dental Association is defending the agencies, saying that multiple trials have been done and none have shown the drug to be effective at treating or preventing the virus.
The reality is ivermectin is approved for use as anti-parasitic. And it can be used in animals as well. So doses vary. And are there drugs that are used off-label, as we say sometimes? Yes, but those are in dire situations. The reality is ivermectin actually has been tried for COVID-19. No improvement has been shown. In our case, for some time it was used in Martinique, but that has still been halted. In fact, some of it was brought into St. Lucia by our friends in Martinique, but then use of it was then not recommended because no improved outcome was seen, not in patients with mild symptoms and certainly not in patients with severe symptoms in the intensive care unit.
St. Lucia's Ministry of Health first advised against the use of the drug for such a purpose back in February, but got resistance from local practitioner Dr. Gilbertha St. Rose for not approving the drug. Dr. Clark adds that the trend of saying that the drug can be used as an alternative to the COVID-19 vaccine is dangerous.
We understand our people culturally that we all like to think of something quote-unquote more natural in a sense for use, and the vaccine seems to be newer and less natural than ivermectin, but we'd like to say categorically, the studies show, the trials show that the vaccines do work in preventing COVID-19, in limiting the spread of the disease to a certain extent, although definitive data on that particular aspect is not yet available, but certainly in preventing serious illness, hospitalization, and death, all the vaccines have been shown definitively to be very effective. The same cannot be said of ivermectin. In fact, the reverse is true.
Effective ways to limit the spread of COVID-19 continue to be to wear your mask, stay at least 6 feet away from others who don't live with you, wash your hands frequently, and avoid crowds. For the Hot 7 News, Nisha Charles reporting.
Thank you, Nisha. Today, Thursday, the 20th of May, the Ministry of Health and Wellness received confirmation from the Ezra Long Lab of 17 new cases of COVID-19. This from a batch of 258 samples. The contact tracing for these newly diagnosed individuals is underway. The Ministry of Health also received confirmation of the recovery of 25 individuals, bringing the total number of active cases to 236. Presently, one of the active cases is requiring critical care at the respiratory hospital. The new cases bring the total number of cases diagnosed in country to date to 4,923. You're watching the Hot 7 TV Nightly News. Stay with us. Still to come, the National Security Minister says student safety is everyone's business, not just the police. The Medical and Dental Association gives a thumbs up to vaccine passports, saying it will soon be a reality. And the Chamber of Commerce, eager to see an increase in the number of people getting vaccinated, throws its support behind the ministry providing people with incentives to take the jab.